right, how are you doing?
I'm good. How are you?
Doing good. Before we start, I just want to say you've done a great job raising Charlie. I've really had a great time getting to know him the last couple of months. We've gotten a lot closer, and I look up to him in a lot of ways, and he always talks about you and says how grateful he is for you. So really excited to talk to you today and have you on.
Yeah, I'm excited too. This is definitely outside my comfort zone.
It'll be easy. Don't stress it.
Yeah.
But yeah, I'd love to talk about a lot of things today, and I don't really know where to start, but I think there's a lot going on in this country right now with, I guess, what happened in 2020 and then what that's led to in the last 5 years as we've shifted in terms of like our trust in the government, our trust in these big bureaucracies and industry, and then there's this huge rise in chronic diseases and diabetes and cancer, and I think we definitely see it as college students now, just seeing people's lifestyle around us. I guess that's definitely an eye-opener about how common unhealthy lifestyle is in people all around us. And I just think that there's so many different things going on. And I learn about something new every 2 months. So I guess, like, how do we get here? Like, where did all of this start?
Quite the journey. I mean, even just since 2020, right? Just what has been revealed, even just about our health since 2020. I guess we didn't realize as a world how out of shape we really were until the people that fell prey to COVID were the ones that were most unhealthy, right? So yeah, we've learned a lot. It was definitely an interesting time. It was very eye-opening for me. I think anybody who has known me for a long time knows that I'm a pretty different person now than I used to be prior to 2020. I was already starting to see things and question things, but I think now it's just very different. The way I see the world, the way I look at our government, the way I look at everybody's health and what I've been told, and I mean, just looking at the food pyramid, like I just accepted that as something that people had done a lot of research, and it was well accepted among people, and I figured, why question it? But I think there's every reason to question it. It's all wrong, and I think now
it's all wrong.
Yeah, and I think that's one of the things on R.F. Kennedy Jr.'s list of things to change. He's upending the food pyramid. He's going to start, looking into the rates of autism and what may be driving that, hopefully with an open mind, and just see where that takes us. So yeah, a lot going on, a lot of lessons learned, and I encourage everyone to do their own research and not just watch mainstream media. And take it.
Well, I definitely think mainstream media. There's so many narratives being pushed that it's even hard for me to understand like who to believe, who to trust. And I was telling you this before, like during 2020. My mindset was just like trust everybody. Like I never thought twice about something. Someone tells me to get a vaccine, I'll just take it. Like I never thought about that. And I think the last 4 years I've definitely started to question things more. And I think I definitely see that as a culture, like the West versus the East as well. Because I think where my parents come from, the culture of the East, you respect the elder, you don't question them. I think this culture of questioning those in authority is definitely bigger in the West, and I think it's starting to get bigger and bigger as the distrust rises. But I see that a lot, like even my grandparents, like they're not gonna, if the doctor says do it, like they don't care. Like the doctor says you don't have to worry about walking every day, just take these pills and you're fine. Like they don't question. And I think that's been baked in so many layers of like how they see the world that they almost can't unsee it. So I definitely think this idea of questioning everything I've only started to pick up recently. But I definitely do think it's important. I think you shouldn't just like blindly trust people and really like critically think about everything anyone says.
100%. And I'm not a huge fan of social media, but I think one of the gifts that social media gives us is information, and knowledge is power, and it gives you facts that you may not hear otherwise. And so when you are exposed to new information, different people's viewpoints, then you can take that and you can decide what you believe, and you can actually look at the research, the data yourself. Whereas I don't think back in the day when I was in school or in college, you had to go to the library. I didn't even have a cell phone then, so it was a very different world. But now everything's at your fingertips. and so you can find a lot of information that wasn't previously available.
Mm. Yeah.
So it definitely has been a gift to have all of that information. And then, granted, during COVID, a lot of that was censored. And that was one of the biggest eye-opening experiences for me, is to realize, how that can even happen. It just seems so dystopian, but it's real. It happened. And it's very unfortunate because a lot of people were misled and they had erroneous information. They were making decisions either with a lack of information or with wrong information. And the people that had the truth and knew the truth weren't able to share it. And that's a huge disservice to everybody.
Yeah, I mean, it's hard to believe that with this much information, it's still hard to get information.
Yes.
I love the internet. I love that I can post whatever I want, say whatever I want for the most part, and gain so much knowledge from so many people. But at the same time, it's so hard to discern, like, what's real, what's fake, who can I trust. And I remember you called COVID-19 your great awakening.
Yes.
And I'm curious about what happened during COVID-19, because I've only started to question it more now, but at the same time, it's like, again, I'm just trusting someone says, and I think one of my own videos got censored, so I started to see like it happening more frequently than I thought it was happening, and I guess the whole storyline is kind of messy in my head just because of all these different things people have told me. So I'm just curious from your perspective, like what happened during COVID.
Yeah. Yes, well, this is something that I have, I've taken the deep dive off the high dive because once I started going down the rabbit hole, I could not stop, and still, I just have a huge appetite for all of that information. I still think I've only scratched the surface in discovering what exactly happened, because, I wasn't that skeptical either when I knew I didn't want to take the vaccine, and I was, hesitant to give it to my own kids, but, somewhere along the way, some of the lies that started to come out, I'm like, okay, there's something terribly wrong here. And I think one of the biggest lies was the origin. Like, where did it come from?
COVID or the vaccine?
COVID. Where did COVID come from? We were told that it was a natural spillover, that it came from nature, it came from a wet market. And then, I started listening to, experts on Joe Rogan that talk about how that's impossible and why we know that can't be true. And some of the experts that initially, early on, were sharing their thoughts on it that would know a whole lot more than Anthony Fauci on whether or not something came from nature versus something that's man-made. And, the specific features of the virus tell us that, it has a very specific sequence in the viral, component itself that tells us it's not from nature. That's something that a human puts in it.
Wow.
So I think that was one of the biggest aha moments, is realizing that this probably isn't from nature. This is a man-made, and it was on purpose. Now, whether or not it was meant to cause a pandemic, I don't know. I still think I'm trying to have an open mind about it and not think that the world's that dark and sinister, but I do believe that the virus was made on purpose.
Mm-hmm.
And that it leaked.
So if it was leaked from a lab, do you think that, based on your intuition, and you don't know, but do you think that their goal was to use it for malicious purposes, or do you think that, it was an accident? Like, how likely do you think it was that it was just an accident that happened to leak when they were doing scientific research?
Yeah, it's an important question, right? Was there some nefarious purpose behind this? And I feel like it's hard even to trust my own instincts, but I feel like I've come a long way, so I would say I still feel like it was an accident. I don't feel like this was leaked out. I don't think, Wuhan, China was going to release this virus. There's, some conspiracy theories out there that they knew, and so and they were quite a bit ahead of us in figuring out how to protect themselves and control it. But then they denied a lot of information, kept a lot of information from us, so it's hard to know exactly. But at this moment, I will say I don't think it was on purpose. I think it was an accident. But if you look back on, how did we even get to the point where an accident like that was allowed to happen? Mm-hmm. That in and of itself is a story. Because I believe it was 2014, President Obama put a moratorium on gain-of-function research because he was actually afraid that something like that would happen. So all of that was shut down in the United States for the most part. It wasn't like a hard pause, or a hard stop. It was more of a pause until we could put tighter regulations on how that research was conducted.
So this is any type of research related to like dangerous chemicals, et cetera? Or?
Yeah, so
Okay.
gain-of-function research where you're actually altering a virus to, like a coronavirus in and of itself is not that dangerous, not that fatal, but if there are ways to manipulate the virus that can make it more transmissible, where your risk of infection is higher, and then you can also increase, the fatality of it, just depending on how you manipulate the virus. So, yeah.
I guess another narrative in the media was like whether it was dangerous or not, COVID itself, and whether the government overreacted by putting these harsh regulations on everybody, masks, vaccines, stay inside, or was it just that the stats were skewed because, he had COVID, but he also had that other disease, and it kind of just compounded. So I still don't know where I stand on that, just because I don't have enough information or talked to enough people about it. But like, how dangerous was COVID? Like, did we overreact, or do you think that there was still, it was still like a viral disease that was going around killing a lot of people?
Yeah, I mean, I think early on, we just didn't know, right? I mean, it seemed to be quite contagious. And then when you know that you can catch something, but you don't know how serious it can, and we saw people dying from it in January, February, March. It seemed to be fatal in some cases, and we didn't really know what the pattern was. Who was dying from it? Or was there something specific about those people? Well, we learned along the way. Yes, there was a specific pattern. Those people were unhealthy. They had multiple comorbid diseases. They're overweight. They just didn't take care of themselves. So yeah, it can be dangerous. I think a lot of viruses over time, they kind of lose their potency, if you will. They start out more dangerous, and then they become less dangerous over time. So I think in the beginning, people just didn't know. So they're, locking down and wearing masks and washing their groceries, and they're scared to check their mail, and, all sorts of crazy things. But over time, we realized that this has probably been overblown. And then there's conspiracies behind that too. Like, was this the government's attempt to control us? Is this, again, is this the start of dystopia? What was behind all of that? And that scares me quite a bit, to think that dark and that deep about it, because I can't say for certain that there weren't elements of that at play.
Well, it definitely showed that they're able to do it. It showed that if they really wanted to, they could censor the media, they could control Facebook and Instagram, and they could spread a narrative and control the dissemination. I think that's like the biggest learning point. That, like, if they want to do something in the name of emergency or national disaster, like, they can do that, which was kind of interesting. I like it.
Yeah, they can. And that's how they gain control. And if you look back over decades, centuries, I mean, the playbook is there. They knew what they were doing. I do believe there's an element that they knew what they were doing. When I say they, I mean Biden administration, because I feel like that's where it all stemmed. Whether it's broader than that outside the United States, yes, I believe so. I mean, we've been talking about a new world order, and we've been talking about a lot of things, population control, and the fact that the planet's becoming overpopulated, and what are we going to do about it? I mean, these were conversations that were happening leading up to, weeks leading up to COVID.
Wow.
And there were discussions about, that a pandemic might actually be convenient if something like that were to happen. And even coronavirus was mentioned as a potential pathway. I mean, yeah, this was like a couple of months before this virus was let loose. So yeah, it's tough not to get yourself in that very dark mindset, but it's also hard to dismiss it, knowing the things that we know now. When you've seen mainstream media completely taken over, and they're given a narrative, and they stick to that narrative, and then they won't talk about anything that strays from that narrative. That's control, right?
Well,
yeah.
Yeah, whether they're right or wrong about it, the fact that we can't even talk about it or disagree is crazy. The fact that I can't even upload a video of a factual scientific study about a vaccine, and that can be posted because somewhere in the guidelines it says that, you can't just talk bad about the vaccine, that's not allowed. I think that is crazy, because because this is a very new vaccine. We don't have enough scientific proof about its efficacy yet, and I think that we need discussions to be able to debate about anything, to really get to insight and get to things that we can trust. But I mean, whether or not they overreacted or not, like the fact that we can't even talk about it and discuss it is kind of crazy to me.
Yeah, well, that right there tells you something's wrong. If you can't have a scientific debate about something, then that should be your first signal that something's wrong, that you shouldn't trust the information they're giving you. And I wouldn't even call this a vaccine, because by, the normal standard of what we call a vaccine, this in my mind doesn't qualify as that. But there is, I believe, a strategy behind calling it a vaccine, because vaccines are protected. There's the Vaccine Injury Act of 1986, and if something is a vaccine, then the manufacturers of that vaccine have legal immunity, that you can't sue them.
Wow.
And so if all you have to do is call it a vaccine, you give somebody a vaccine, you put it on the childhood vaccine schedule, and it's mandated for children. They have to have it before they can go to preschool or to school. Vaccine mandates were a real thing. People had to get them to go to school, to keep their job. They utilized OSHA to, coerce people into getting these vaccines. And if you can't talk about it and if you can't debate it, and that should be a rule from here on out for all the young people in the world listening to this. If you can't talk about something, you should question it. Mm-hmm. Because everything is worth a debate, especially on the college campus. I mean, isn't that that's the biggest learning curve, and one of the best reasons why people go to college is to learn how to debate and find themselves and figure out where they stand on certain issues. And if you can't talk about it, it's hard to figure out where you stand.
Mm-hmm. Definitely. I mean, I think free speech is the first thing that goes away in most authoritarian regimes.
Well, yeah, that's the first step in the playbook, right?
Ideas are powerful, more powerful than words. I mean, not more powerful than weapons.
Yeah, they are, absolutely. And, you start censoring people, that should be a huge red flag.
Mm-hmm. I'm curious about the approval process for this vaccine, because I know it was done through the EUA, emergency use authorization.
Yes.
'Cause I know you're an expert in more like drug authorization. I don't know how that whole process works. I know it takes like 9 years or something through the FDA for a drug to get approved and go through all these passes, but like no one really knows like what's happening. We kind of just assume that FDA, it's probably fine. Again, vaccines are different. There's a whole different process, but what does like emergency use authorization mean? Like do we skip steps in authorizing this? Like, is this even a vaccine? Like, what even is this thing?
Yes. So emergency use authorization is a pathway for the FDA to utilize to expedite the approval of something, to get it in the hands of people faster. And also, again, that lends immunity to these manufacturers. So if you call it a vaccine, that's one level of immunity. If you distribute it or allow access to it through the EUA, that's another level of immunity. So again, people could not sue. If there were harms, if they felt that they were harmed by this vaccine, they couldn't sue the manufacturer on multiple levels because of the Vaccine Injury Act of 1986 and also through the EUA pathway. In order for something to be distributed through EUA, there have to be no other medications available at all that have been shown to be effective for that particular use. For example, and this is going to get us completely censored off of YouTube, but
let's try our best.
Hydroxychloroquine, ivermectin, steroids. I mean, there were multiple products that people felt very strongly would be quite helpful. But they weren't allowed, because if the government acknowledged they had any utility whatsoever in treating COVID, then you couldn't utilize the EUA for the vaccine distribution.
Wow.
So again, they wanted this vaccine, and they wanted everybody to get it, and they didn't want any liability, no ramifications. They had to deny efficacy for any other drug, because otherwise this vaccine wouldn't have had the pathway that it had.
If we try to steel man their case, like, what are they thinking? Are they like, oh, like this vaccine is super dangerous, or this COVID-19 is super dangerous, we need to get the vaccine, we need to keep people safe, so just like brush past these things? Like, what are they thinking? Like, what are they trying to justify?
Well, so why did we expedite it?
Yeah.
I think people were desperate. They're like, oh, here's this virus, we don't really know how fatal it is, how contagious it is. Like, to make the American people feel better, the world feel better, we have to get something out there for them that will hopefully provide some level of protection. And the messenger RNA virus or vaccines are not new. I mean, they had been explored for decades for cancer because we thought, you could potentially make something very individualized for the patients. You take a little tiny piece of the cancer itself, and you create a vaccine for it, and then that could, help you fight your specific cancer.
Is that done currently? Is that done currently for cancer patients or no?
It is not through the messenger RNA vaccine. It is through other methods.
Interesting.
But yes, it's a there are marketed drugs now that will fight against your particular cancer. So and that's a huge step forward. I believe there's a drug called Keytruda on the market.
Yeah, that sounds really interesting.
Mm-hmm. And it's fascinating, but why do we expedite this? I think people were desperate. There were people that knew that they messed up when they let this virus, this research happen in the first place, knowing there was a moratorium. What did they do to get around that? How did it even end up happening in Wuhan? Well, Obama shuts it down. Fauci's like, I'll just send it off to China. We'll continue doing what we want to do. We'll do this research there. And then, oopsie, we had a lab leak. And then knowing that all of this was happening and being funded by U.S. citizens' tax dollars, well, it probably wasn't going to go over very well with the American people when they found out that our money is being used to fund something that was not supposed to be happening to begin with. So knowing that we didn't want any of that to get out, like that was a huge cover-up, right? We cannot let people know what really happened, so we're going to tell them it's a spillover from nature. We're going to keep it on the down low where this funding came from to begin with, and we're going to create this vaccine, and people are going to think that we've rescued them, we've provided them with something that's going to help them. And again, did they knowingly distribute this vaccine, knowing how dangerous and unsafe it is? Because in my opinion, the vaccine is way worse than the virus. This is where the cure is way worse than the disease. Oh yeah.
Wow.
They've downplayed the safety profile of the vaccine, and they've upplayed the severity of the disease itself.
Yes.
So, I mean, I've had COVID multiple times. You've probably had it. I mean, It's been all around. And I think when we look back at how many people have died from COVID, and I think there's an article that just came out a couple of days ago that the number of people that have died from COVID versus died from the vaccine, it's way more.
Wow.
Leaning towards the vaccine, yeah. But those numbers have been covered up. I mean,
but it's so hard to determine if you died from the vaccine. I feel like they'll try to find a different reason they died or something.
Yes. Well, I mean, they even tried to tell you had COVID or you died from COVID when you died from a car wreck.
Yeah, I've heard about that.
I mean, and if you would put on your death certificate that you died of COVID when someone got run over by a car, your funeral could be paid for. I mean, these were the things the shenanigans that were happening.
To do it.
Yeah, you had every incentive, and hospitals got paid so much more if they had a patient, they were treating a patient with COVID. If you put them on a ventilator, you got paid a whole lot more. Whether they needed a ventilator or not, you're going to get one. And from anybody who's worked in an ICU, myself included, that when you put someone on a ventilator, more often than not, they don't come off of it.
And where is money coming from again? This is government funded then? Because they're saying that, if COVID, we'll fund it.
Yes.
Wow.
Yes. So the government's giving hospitals more money. So the more cases of COVID you have, and the more people you put on ventilators, and the more people you put on remdesivir, you just keep making more and more and more money. And there's no money in ivermectin. There's no money in steroids. There's no money in hydroxychloroquine. But there's money in all these other avenues. And sadly enough, Anthony Fauci, he received royalties from the messenger RNA vaccine from Moderna. There's some entanglement there, and I think a lot of people don't know that either. So there were some perverse incentives to push this vaccine forward. Whether or not that was the most appropriate treatment for people, it's hard to say because there's just so much entanglement and corruption there.
The way you describe it, it looks like they knew what they were doing all the way along. Do you think that there's any degree that there was a mistake? Or do you think that they genuinely had good intentions the whole time and they made an accident? Or do you think they genuinely the whole time knew what they were doing and there's some other intent behind it, like for control's sake or for really testing the population's sake.
Well, in the beginning, I was willing to give them the benefit of the doubt. Like, okay, they don't know whether or not this vaccine's going to work. They're hoping. They tried it in cancer. It didn't work there. There were some pretty bad side effects, but nobody really talked about those. But they were hoping it would be different, for this particular disease. And but once you start really digging into the facts, my opinion changed, and I thought, yeah, they knew what they were doing. And even if they didn't know what they were doing in the beginning, they certainly knew a few years down the road, and they should have corrected course, but they didn't. I think one of the biggest eye-opening moments for me is when one of the executives from Pfizer was testifying, and did you hear about this, where they asked
Maybe.
them,
Let me go, yeah.
well, did you test the vaccine to see if it lowered transmission and infection rates? And they're like, oh no, we didn't test that.
Is there a video of that?
Yes.
Can you pull it up too?
Yeah.
I don't think I've seen this.
Yeah, and I was like, are you kidding me? Like, okay, well, what do you give somebody a vaccine for? If it doesn't decrease your risk of transmission, so giving it to each other, and it doesn't decrease your risk of getting the infection, like, why would you ever take a vaccine?
So are there, from the studies we have now, like what are the biggest dangers of the vaccine health-wise? Like what are the biggest side effects?
Well, I would say neurological side effects, I mean, they're huge. So whether that's, did you find it?
Yeah, try this first one. Pfizer admits jab was not tested.
Yeah.
Well, Pfizer has admitted it lied about its COVID-19 vaccine efficacy before it entered the market.
It's the British
It
media.
in Parliament, it was not tested before general public use. Now, this is raising concern as many took the vaccine hoping it will protect them. So for some reaction to this, we're joined now by vaccinologist Professor Shabir Mahdi. Prof, thank you for your time. Your immediate reaction to this.
I wonder if they have the clip in this video.
Yes, I think we need to be careful how we interpret what was said. So the vaccine was evaluated to determine whether or not it protects against symptomatic COVID-19. The vaccine was not, the vaccine studies weren't
That's
designed.
fine. Oh, this is Australia. No, South Africa.
Transmission of virus, and those are two very different issues. But as it happened, although the clinical trials didn't evaluate whether the vaccine prevented transmission of the virus, the subsequent effectiveness studies in a real-world situation did demonstrate, at least in relation to the original virus that was circulating, that a vaccine was able to reduce the risk of transmission as well. So there's two different aspects to it. The one in that Pfizer did evaluate whether the vaccine protects against symptomatic COVID-19, and for the original virus that circulated, the vaccine effectiveness was close to 95%, lower risk of developing symptomatic COVID-19. But the initial studies weren't designed to determine whether that would in preventing transmission of the virus between people as well. But like I said, that was demonstrated in follow-up.
Also, are you doing screen recording?
Right. I understand at this point the South African
Alright, just start it now, you're fine. That's pretty crazy.
And there is actual video of the Pfizer executive admitting that.
Yeah.
In
I'll
front
try to
of
look for it later.
Yeah. And you could tell, like, she was just like, oh, please don't make me admit this. And people asked her, like, well, why did you say that? And she's like, yeah,
Is she still working for Pfizer?
I don't know. I don't know if she was able to keep her job. There
It's
she
her?
is. That's
Okay,
her.
let's
Yeah.
see it. But can I start the screen recording first? Real quick, thanks, bro. So yeah, you were saying there's like neurological impacts.
Yes, so a lot of neurological issues, whether it's, dizziness, Guillain-Barré syndrome, there's just a whole spectrum of neurological side effects that we see, and pretty severe ones. There's myocarditis. We know
What's
that
that?
myocarditis is inflammation of the heart, and basically ends up resulting in scar tissue in your heart, and the heart doesn't really have a way to heal itself. So if you develop scar tissue, you lose tissue in your heart becomes less, it doesn't function as well. So that can be a big problem, There's pericarditis, which is similar to myocarditis. It's just a very specific part of the heart that becomes inflamed. But we know that the way this vaccine was made, it's in a lipid like a nanoparticle, because it's hard to get the vaccine where you want it to go without this technology. So, but as a result of that, it concentrates in certain tissues in the heart, the brain, the ovaries, are some of those areas where it concentrates. So then you see fertility issues, you see cardiovascular issues, you see neurological issues, brain fog, fatigue. Some people call it long COVID, but it's interesting because the spike protein is what is toxic. You have the spike protein whether you have the virus or whether you have the vaccine, you're getting spike protein. So you can see the same side effects from the vaccine as you do the virus itself. Sometimes it's hard to tease all of that out. But over time, if someone hasn't had COVID, but they've had the vaccine multiple times, and with each subsequent booster, you do see more and more side effects.
Interesting.
Yeah.
Check it out. And I feel like a lot of those effects happen over a long period of time too. So it's hard to identify in the beginning. Like, oh, it's not immediate.
The Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market. If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it entered the market? No. We have to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
God, she lost her job for sure. That's wild.
I'm sure Pfizer was not happy with her.
That's crazy.
But yeah, so it wasn't tested to see if it can decrease transmission or infection rates. So, okay, well, why would you take a vaccine? Well, so then they massage this into, okay, well, it decreases, how sick you get. You're not going to be as sick. Your symptoms won't be as severe, and less people will be hospitalized, and less people will die. Okay, well, okay, great. Well, show me the data for that. No data for that. We have not been able to show that. So, and even just showing, you hear people, oh, it was 95% effective at reducing, whatever. Like, okay, well, if it's not infection, it's not what was it effective at? So they talk about, 95% effective. Okay, well, we need to know exactly what the context is for that. And people don't understand the difference between absolute risk reduction and relative risk reduction. And, I think that's a very important concept that people don't know.
Can you explain the difference between those two?
So an absolute risk is if your risk is 10% and it's reduced to 5%, right? Relative risk is so that's like a 5%, but then you take relative risk, it's of a larger pool, so it looks like it's a much higher percentage than it is. If you're reducing your blood pressure and it reduces it, effectively like 50% of the time, that's important to know. But if it's not reducing it, I guess compared to the bigger pool of people, then it's not as impressive.
I think it's so easy to make stats sound really big. When you really go digging into the studies, you're like, oh, there was this factor and there was that factor. And I think my eyes opened to that in the last few years. Yeah. Mainly reading about food industry studies, because I've read a couple books now that dive into, there's these big beliefs we have about what food's good for you, what food's bad for you. When you go digging into studies, not only is there corruption in terms of who's funding the studies, but there's also but they only tested the impact of 1 part per million in a week or something like that, instead of what happens if you do this for 10 years. And I think that there's no studies that even exist that study that, and the few that are there, no one talks about them. Right. Which I think since then, when I hear these stats, 95% risk reduction, so I was what does that mean? Tell me what that means, explain it to me, go in the data, and the articles that we end up reading that refer to these studies kind of reframed in the way they want to kind of spread their narrative. So I think it's, again, it goes back to the trusting. It's so hard to actually be a critical thinker and to look at the details, because no one has the time for that. We also want to just hear the thing we want to hear and then just roll with it. So right.
Well, if you are doing a clinical trial and you only have 2 cases of COVID, one of them occurs in placebo, or 2 of them occur in placebo, and one occurs, on the vaccine. you would say, well, that's a 50% reduction. But really, truly, you're talking about one case, right? So are you going to hang your hat on, one less case of the virus infection? Or would you rather see, like 10,000 cases in, your placebo patients and 5 in those who got the vaccine? That would be more impressive, right? So that's kind of the real life example of relative risk versus absolute risk reduction.
For sure. Going back to the vaccines, I think that I want to understand censorship a little bit better, because technically if YouTube takes on a short of me talking about vaccines, that's not illegal. We can debate whether that should be the case or not, and I think social media is such a public utility now that we should potentially be looking at if they're allowed to do that or not. But I think the big thing about this election was that, we have Zuckerberg come a couple months ago and say that the government pressured him to do what he did, right? And there's a huge public conversation about that now, about like the government's role in this, which I think we weren't talking about before. So like, what actually happened with that, based on what you know?
Yeah, well, I think the Twitter files, you've heard of the Twitter files, right?
Yeah.
This is where several journalists were given access to all of the emails exchange and the records, the files between the government and the the people that were in charge of Twitter at the time. So once Elon Musk came in and took over and gave these journalists open access to everything, that's where everything blew up. It all surfaced from there. So then we knew there was actual censorship going on. I would say we're going to look back one day at like what are the most important events in history. The Twitter file release and Elon taking over Twitter, or X, whatever we want to call it now, is one of the most monumental points in history. I think he single-handedly saved free speech. I do. So kudos to him. So, Elon Musk, I don't know. I don't think he knew what he was doing when he spent $44 billion and exactly what that would translate into. But basically, he bought free speech for everybody.
That's a great way to put it.
Mm-hmm.
I still think there's so much. I think there's so much out there for people to understand what happened now. Like the facts are out there, the files are all released,
Yeah.
but there's still so much resistance to believing it. I wonder where that comes from.
Again, mainstream media, I think, does a number on people and getting people to believe that, oh no, this is just a conspiracy, and the government has every right to shut down things. I mean, they even admitted the things that they were censoring were true, but they didn't want to, cause vaccine hesitancy. Okay, well, people need to know the facts, and if they decide not to take a vaccine based on those facts, they should be allowed to do that. Mm-hmm. You shouldn't take the facts away from, again, dystopia. Why would you not want people to know the truth? You want them to be, I guess, tricked into taking a vaccine that A, wasn't even tested to see if it's going to be effective, B, that has a long list of side effects, and we don't have long-term safety data on this. I mean, we have 5 years worth now, or 4.5 or so, but we didn't have long-term safety, and that is, as a pharmacist, that is very important to know what the long-term side effects of something are. And that is one of the issues I have with all vaccines, is vaccines are not adequately tested.
Even non-COVID ones?
Even non-COVID ones, especially non-COVID ones.
Tell me more about that.
Yeah. So, I mean, there are no properly designed, placebo-controlled trials for any vaccine that's on the market today. I think we need to start over, square one. We need to look at the ingredients. We need to properly test them against an actual placebo. So somebody that gets saline and not like the diluent or the vehicle that the drug is actually put into, because the virus or whatever is specifically designed as the vaccine itself may not be the culprit. It may be all the other things that are in the product, such as thimerosal or preservatives or other adjuvants that get put into that product for various reasons, for stability, for shelf life, etc. So you can't have those in your placebo and claim it's a placebo, right? Mm-hmm. It needs to be something very inert. It needs to be water or saline or something that we know is not harmful in order to be able to compare the safety profile of that versus something else. And that's not adequately done. If you look at the trials for any vaccine, there's no real placebo, and the follow-up, the safety follow-up is like days. We need much more than days of follow-up for a vaccine. We need years and years to see what are the long-term downstream effects from these vaccines. We need to be open to discussing whatever comes out of that, too. And I think that's, what our current Secretary of Health and Human Services is trying to do. I think he wants to have properly designed trials. People want to take vaccines right now, knowing that they weren't properly tested, and that's their prerogative. But do you want to wait on data that will help guide you in your decision making? True data. You want to know the truth. You can wait on that. I think people should be allowed to wait on that. And if you still don't want to take it, I think that should also be your prerogative. But as long as a vaccine is on the childhood vaccine schedule, it is not your prerogative. You don't get to decide for your child whether, unless you're going to homeschool them, but you don't get to decide whether or not they get a vaccine.
I mean, it was so normal for us growing up. It was just like something we did. Oh, it's like flu season time, get your vaccine, and it's such a normal part baked into our day-to-day life.
Well, yeah, and I mean, if you look at the number of vaccines, I think there were 5 vaccines against 7 diseases when I was a child, and today there's over 70. Yeah. 70 shots that you get for 17 or so different diseases.
It's crazy.
Yeah, and you have to look at, do you actually need a vaccine for that disease? In my mind, if, number one, the vaccine has to be effective, and if you don't know whether or not it's effective, then, that's hard, right? I don't think I want to expose myself to something if it's only going to reduce my chances of getting the disease by a few percentage points, especially if it could cause tremendous harm, right? And, okay, well, what if you get the disease that you're trying to vaccinate against? Is there a treatment for it? If there's an adequate treatment for it, then I would argue you don't need a vaccine for it.
So do you get vaccines then, ever, for anything?
Do I? No.
Yeah.
No. I would never get another one ever, and my children won't either.
Good.
And my dog won't either.
Oh, yeah.
No. We got kicked out of our vet because I won't give my dog vaccines.
Yeah, didn't they say that dogs are getting allergies now because they started getting vaccines or something?
And cancer, yes.
Yeah, that's crazy.
Yeah, and it's always, your dog needs this vaccine, that vaccine.
Tell them about shellfish allergies and that sort of thing.
Well, that's the other thing. We do see a lot more allergies, whether it's peanut allergies, shellfish allergies. Like, where is all this coming from? I mean, a peanut allergy, like, I don't even think I ever heard of anyone having a peanut allergy. Maybe
when you were growing up?
When I was growing up.
Really?
Now they're everywhere. Everybody has a peanut allergy.
Yeah, my sister has it. Everyone has it.
Yes, and again, you have to. What does a vaccine do? It manipulates your immune system, right? And so you have to wonder where these allergies are coming from. We don't have allergies really, or I guess say food allergies anywhere in our family. But my son has a shellfish allergy.
Charlie or other one?
Charlie. Yeah.
I think he was talking about that.
Yeah. So like, how does this happen? And in my heart of hearts, it's my opinion, and a lot of what I'm saying here today, just to be clear for the record, has no reflection on who I'm employed by or anything else, but it's my opinion, and I encourage everybody to do their own research. Don't take my word for it. My message today is go do your own research. Don't listen to what somebody else is telling you to believe. Go figure out what you believe. But you gotta, and a lot of people don't want to take the time to do that. I was listening to a podcast once where the interviewer was arguing with RFK Jr. Like, I don't have the time to go look and see whether or not vaccines cause autism or cause other side effects. And he's like, well, when you decide to have a child, it becomes your obligation to do that research so that you don't end up harming your child unintentionally, right?
Yeah, I had this couple episodes, 73. I had this guy who was like studying neuroscience here, and he was arguing with me saying that there's no evidence that allergies cause autism or anything. So I was curious.
Vaccines cause autism?
Yeah.
Yeah. I mean, are there any head-to-head trials, meaning people that got the vaccine versus people that didn't get the vaccine, and then you assess them long enough down the road to see, is there a difference in the incidence of autism? No, there are no studies like that. But why are there no studies like that? Nobody wants to do those studies, right?
Mom, talk about the autism rates too. Like, as
Oh.
of like a long time ago versus now?
Yeah.
Skyrocketed.
Just, a couple decades ago, or not even that long ago, it was like 1 out of every 150 kids had autism. Just like 2 or 3 days ago, it just came out that the rate of autism now is 1 out of every 31.
I see it everywhere.
Children, yes.
It's crazy.
And it's only getting more prevalent, and it's getting, like, the severity of it is worse.
That scares me a lot.
Yeah, I mean, not everybody who has autism, bangs their head or, walks on their toes or isn't toilet trained. I mean, that's only about 25% of people with autism. But it's becoming more severe. Like, it's not going to be 25% a few years down the road. Just a couple of years ago, it was 1 out of 34, I think. If you look at the state of California, which has a lot better, mechanisms for collecting the data, the rates are even higher.
Mhm.
It is very scary, very, very scary, and it's especially scary for boys.
Really?
Because the rates are much higher in boys.
Is there a reason for that?
I don't know that we know exactly the cause for why it's higher in boys, but I mean, and I'm not saying that vaccines are the only reason.
There's a lot of stuff.
We don't know. We just don't have the data one way or the other to say. I mean, there's a lot of, circumstantial data, retrospective chart reviews, things like that it's hard to hang your hat on those types of studies where you look retrospectively and say, oh, well, the Amish don't vaccinate their children, but they don't have any autism. I mean, it needs to be a more rigorous study than that. It can't be just, because you get a lot of selection bias. And so I just think we don't have data to really say one way or the other, but I think we need to address the question. It needs to be something we can talk about. We can't just shut down people that say, well, I truly have this question, I want to know. Like, let's do a study, let's find out. Let's look at all of the data collectively. I mean, if you look at a Cochrane analysis, I don't know if you're familiar with the term Cochrane analysis, but it's basically like a whole bunch of studies that are collectively together,
Mm-hmm.
and you try to analyze the data as a body of literature, and that's what a Cochrane analysis is. And it's always been like the gold standard for, trying to make heads or tails of something. And when there's a Cochrane analysis that comes out, you're like, oh yay, this is going to get to the bottom of this. Well, I would say a Cochrane analysis would say there's reason to be concerned. So we just need to do our homework. We need to do the research to answer the question.
Mm-hmm.
I do believe there are other reasons why there's autism, and allergies. I mean, environment, food, all the things that we're doing that we shouldn't be doing definitely aren't helping us.
Yeah, that worries me a lot because I definitely want to have a big family and plenty of kids, and I want us to all be healthy and live long and happiness and all that. But I think that it's easy to start overthinking everything. Like, oh, there's like microplastics in the air I breathe, and the seed oils in the dining hall, and like sometimes you can go too far down that rabbit hole.
Oh, it gets depressing, right? Yeah, it does. There are moments where I'm like, okay, I need to just stop thinking about it for a while, because you do tend to think the world is a very dark place, and you don't want to. I mean, that alone has an effect on your mental health and just your overall happy quotient in life. You don't want to think that way either, but you don't want to be naive.
Mm-hmm.
And having a big family, you need to know the facts. And I mean, even if you wait till you're older to have children, that alone increases the risk of your offspring having autism, especially if the male is older. For some reason, yes, the father being older is associated with higher rates of autism in the offspring.
Very interesting. Yeah.
Mm-hmm.
Well, yeah, because like the age at which women are having kids now is also so late now too, for both the male and the female.
Yeah.
So that's also another big concern. But
Yeah.
I just think that it's definitely possible to live healthy. Like, I saw that when I went home to my grandparents' house in India, like last summer, and everything they eat is actually organic, not organic from a farm, but they grow it in their own home. Like, they go down the street to someone who kills a chicken in front of them and they eat it the same day.
Yeah.
Like, there's no preservatives or anything, so it's possible. But
Yes.
I think if you're living in the West, you're a college student, okay, you can't control every factor. The dining hall's convenient. If you want to eat a lot during the day, go to the gym. Like, it's hard to. And also everyone's just looking at you like you're a kook, like you're just on the side, like doing your own thing, and come with your little tin box every day. So I think it's hard, but it's definitely not impossible. I think it's definitely like there's a million things you can do, but even if you focus on maybe the few most important ones, like maybe we can increase the chance of being able to live healthy and having a healthy family. But
We need to shift the culture of the world, especially of America, because we are like one of the most unhealthy nations, and it's just almost become taboo to be in shape, to want to eat healthy, to not be overweight. I mean, obesity is the norm now in America. You know, like 75% of people are either overweight or obese. 40%, over 40% are obese, adults.
it's crazy.
20% of children are obese.
They're just being born.
I think I saw a stat that said like the average weight of an adult female in the United States is like 177 pounds.
That's crazy.
And like the average weight of an adult male is like 199, something like that. It might be a little off, but it's around there. So
Yeah.
I wonder if you can search that though. That's insane.
Yeah.
And I feel like I've heard a stat where kids, even infants that are just born, are heavier. Isn't that true?
Yes.
That's crazy.
Yeah, I wouldn't be surprised because, you know, diabetes is, you know, way more common now, and diabetes, women with diabetes end up having heavier children.
Wow.
And I mean, and there's data to suggest that, you know, when
He was right on.
yeah, there we go. The average weight, 171
Bro
pounds.
studied this late at night.
Wow. Yeah. So, I mean, this is concerning. And, you know, when you've got a culture and a mindset that favors and supports that, you know, we wanted to make it acceptable for people to be overweight now. We go out of our way.
And then there's like body positivity and all that too.
Right. And, you know, I don't believe in making people feel bad, but I'm not going to look at someone who's overweight and be like, oh yeah, you've got it all together, you're doing it right. I just don't think that we're doing the world any favors in that way.
it's okay. I believe in making people feel bad. It's fine.
Collaborate.
Yeah. I mean, we shouldn't fat shame, but we shouldn't skinny shame either, and that happens. You know, somebody that wants to take care of themselves, wants to eat healthy. I mean, I just think that, you know, we all have choices, right? But as long as we're in the culture that we're in now, nothing's going to change. We're on a train going down the track the wrong way. And it's going, you know, first of all, to get the train turned around, you have to stop the train. And then you have to turn it around and get it to go back the other direction. That's going to take a monumental overhaul of everything, especially our regulatory agencies, all of the different government agencies and all of that. We got to clean house. We have to clean house.
There's a lot that has to be done.
There has to be done, and hopefully we have more than 4 years to do it. But you know, things are moving at a snail's pace even now. I'm not satisfied with the rate things are moving. But you know, when you get sued left and right for everything you want to try to do, it makes it a bit difficult. You know?
Yeah, I mean, I definitely think they've been huge action takers for sure. Like they've at least attempted, at least in different domains, they've made a lot of progress. I think the health one is slower, but I know that RFK has done some things. Like they've cut down, I think from like 21 to 15 agencies within the health sphere, food industry sphere, and then I think they just start something else like the HHS or something, or not the HHS, something else. I think you just opened a new one, but I don't really know like what do you think the timeline will look like for that? Because it's obviously much harder when, I think with the food industry it's a much tougher one because of how many different factors and pieces are baked into it. Like it's not just like one problem. So,
Right.
I mean, what do you think we could really accomplish in 4 years?
I think it depends on how brave people want to be, and then how much resistance there is from the other side of the political party that's not in power right now. I feel like there's so much that's driven by politics that even if there was a clear solution, that if it wasn't an idea brought forward by the Democratic Party, that there's going to be
Resistance.
opposition or resistance to it. You know, there are some things that are just black and white, and I think people have to be brave. You have to have somebody that's saying, all right, I'm concerned about the rates of autism, and we need to do studies to look at this and figure out what's causing it.
Mm-hmm.
And at the end of the day, if we find that vaccines have no role and we don't see an association or, you know, a direct correlation whatsoever, fine. Let's say that. Let's announce it to the world so we can put that behind us and move forward. But we need to at least allow the question to be asked and allow the debate to be, to be out there. And right now we don't have that. We need to have tremendous bravery. We need to have someone take the COVID vaccine off the market. I mean, that should have been done, long time
Who's
ago.
gonna do it?
Who is giving this vaccine to their babies? It blows my mind. Blows my mind. I can't even think about it. It makes me too depressed to think about a baby getting that vaccine.
Yeah.
Mm-hmm.
And I think so many people are clueless to it at the same time. But I'll sit with someone in the dining hall who's eating like a pizza or something. They're like, oh my God, like America, like such good fitness culture here. Everyone's thinking about their protein. He's so happy that there's so many gyms everywhere. America's so healthy. Life expectancy's through the roof. And I just think that most people don't even understand that. They're just stuck in that narrative.
I bet you if you ask the average person on this campus, they wouldn't even realize that the life expectancy right now has decreased over the past few years.
Yeah, it's crazy. The first time.
Yeah. So what's causing that? I have some thoughts, but I think we do need to take a long, hard look at our lifestyle. People sitting around, they're on their phones, they're not interacting, they're not outside. There's so much more that we need to be doing that I just don't think people want to do it, because it takes work, it takes discipline, and some of those things are just hard to come by, especially in today's society.
For sure. Yeah. What do you think are like the biggest steps culturally that, like, if there's someone watching this, like, I think that a lot of us already like go to the gym and things like that. Maybe there's people who don't, who could start doing that. I think diet's something that people don't really understand much about. Like I guess it's confusing to even think about like what good diet means. Does it mean that I get my protein and calories in, or does it mean that I pay attention to the ingredient list? Like, I feel like people don't understand that yet. So like, what would you tell someone our age? Like, where do you get started with all this?
Yeah. I think it's quality and quantity. Quantity is very important. The quality is also very important. So, where are you getting your food from? Is it ultra-processed food? Like, that should never enter your body. It just shouldn't. My kids know that. Charlie's always told me what is it? My gypsy food that I eat? Yeah. Calls me a gypsy because, I'm all about, your fruit and your berries and your seeds and these things. I think those things are important to focus on. Whole food, organic food, watch how much you eat, watch the quality of the food that you're eating. It should always be organic. Cook your own food. You can cook your food. He cooks his food. Everybody can cook their own. Even a college student can cook their own food. I just think that people don't realize that that's something they can do.
I think you can cook your own food as long as you have like your own place. I know for like freshmen typically it's a little harder just because you have your dorm and that sort of thing, but like, you can still choose healthier options at the dining hall. You can get the chicken instead of the brownies and stuff and the pink lemonade, right?
Yeah.
Does your dining hall have like a kitchen? Or not dining hall, your dorm have a kitchen?
No, it's a pretty small dorm.
Okay.
But I think that at least at a school like Michigan, most people do move out sophomore year. So, but I think that even upperclassmen are just eating out every day. And they're just okay with it.
Yeah.
Every day, every meal. It's crazy.
Yeah, and once you kind of get into that mindset as an adult, you just continue down that mindset. It's hard. Some people don't ever even awaken from that. They're like, oh, well, this is just what we do. This is what I've always done. They were raised that way. They go to school, they go to college, they continue that, and they move on to their adulthood. They continue that. They teach their children that. It just perpetuates, right? But, okay, so it's the same, no different than school lunches for children. If you offer children in their school lunch a bunch of crap, then they're going to eat crap. But if you take that out of their lunches and it's not even an option, at least there are healthier ingredients. Reach for the healthier ingredients. And that just should be top of the list. There's no reason why you can't get fresh fruits and vegetables. Even if you just try to focus on that and focus on protein sources. But if I'm a college student today, watch everything you put in your mouth. Please avoid things that are ultra processed, that are packaged, and just try to make the best choices that you can make in the years that you're in a dorm and you don't have access to a kitchen until you can move out. And then one of your top priorities should be, I'm going to start cooking my own meals.
Mm-hmm. I think that for the most part, I eat what people consider healthy in the dining hall. Like, I have not had a single dessert. All I do is like the chicken, the meat, rice, vegetables, fruit.
Yeah.
But I still think that at the same time, on paper it's healthy, but there's also the oils they're using, the source they're getting it from that people don't pay attention to. And for me, that's a big problem because I want to cook next year, and the convenience of the dining hall is making me attracted to considering another dining hall pass for next year, just because I'm living 10-minute drive away. You know, I can't meal prep every meal. I'll be on campus. I want to grab lunch. So, and ideally, I want to fully shift to cooking out my own food, but I think that it's so easy to just opt for the convenience of dining hall food. So I guess the question is, if you're eating healthy, like how bad is it dining hall food?
I think it's terrible. I mean, I think you need to look at what you need to think about your ancestors. They didn't have dining hall. They would go all day sometimes with not being able to eat because they couldn't get back to their little, fire and cook it. I would just think, like, it's not going to kill you not to be able to stop midday and bring snacks. You do what you have to do, right? And if you eliminate that as an option for you, then you won't do it.
Yes.
You're not going to be eating. I mean, do you think the chickens they have in the dining hall are free range and organic? Absolutely not. Do you think they use seed oils? Absolutely. So just avoid that. Just take that out of the equation and say, all right, I'm going to meal prep. It requires work. It requires thinking ahead. I spend my Sundays, my Monday mornings, hours meal prepping because I know if I don't have something convenient to reach into the fridge and grab, I will make bad choices. I will grab the chips out of the cupboard or something versus, the fruit that I've already cut up. So it's how important is it to you? It can be done. Your ancestors did it, so you'll be fine, but just eliminate that for yourself. I would say do not get yourself a dining hall pass next year.
It's a good advice you're giving me. I think I'm definitely going to take a lot of time learning to cook this summer then.
Yes. If you need help learning how to cook, let me know.
Yeah, I will 100%.
I'm sure your mom can teach you a thing or two.
Yeah, for sure.
She's
I'll spend some time learning this summer. But I feel like it could be like a fun experience too, like learning that new skill. Like I've tried cooking before, and I feel like I'm not the best chef, but.
I mean, it's trial and error,
Yeah.
and it just make it fun. I mean, I don't know if you watch sports or listen to music, but I mean,
Throw it on, yeah.
put your music on and just, let that be your entertainment. And you're gonna make mistakes. You're gonna burn things. I mean, goodness knows I have. I taught myself how to cook. My mother, didn't teach me how to cook. I had to learn that completely on my own.
Mm-hmm.
I had friends that were great cooks, and I was like, I need to come sit with you for many hours, and you need to tell me what I need to do. And one of my girlfriends is an amazing cook. She's from New Orleans, and she's my go-to. I'm like, I want to make some applesauce. Tell me, how do I do it? And she's always got all of her recipes in her head. Nothing's ever written down. I'm like, will you give me a recipe? She, well, I don't have one. I'm like, well, that's great, because I need a recipe.
Yeah. I usually do buy organic. I think that I've started to think more about organic food, like more in depth recently, because my friend lives on a farm and he's told me that organic is kind of bullshit as well. That based on the regulations, obviously it's better than normal, but so I'll still opt for that. But I'm just curious about, like, is organic like super good, like you're set, or the things you should be concerned about with organic?
You need to be concerned, and I'll tell you a story about this.
Okay.
Organic food still has pesticides. And it has organic pesticides, and those organic pesticides are less well studied, so it's less of a known, profile than the non-organic pesticides. So don't think that you're getting pesticide-free fruits and vegetables, because that's not the case. In fact, Charlie had an allergic reaction to strawberries. They were organic strawberries.
Wow.
And I was like, well, he's been eating strawberries his whole life. I mean, I don't understand. I mean, again, an allergy can pop up at any given time. Your body can just decide, well, I'm no longer going to tolerate.
Is that even common, like a strawberry allergy? Like, it can't be the strawberry.
It wasn't. It was the organic pesticides on the strawberries that he was allergic to.
Organic pesticides?
Yes. So I sent him to school, his strawberries in his lunchbox. He eats the strawberries. His eyes swell shut. I get a phone call from the school.
Fully shut.
Like,
wow.
Horrible. Like, he calls me from school, Mom, my eyes are swollen shut. And I was like, oh, Charlie, don't be so dramatic. Go back to class. Next thing I know, I get a call from the school secretary. No, Miss, eyes really are swollen shut. You need to come pick them up. That was not one of my better parenting moments. So then I'm like, well, I have no clue, like, why his eyes have swollen shut. I don't know, like, how did this happen? So I send him to school the next day with some more strawberries. And this time, his throat starts swelling, his tongue, swells up, and So I get another phone call, and I end up taking him to the hospital twice for allergic reaction. And then he had to have a whole workup for food allergies.
Wow.
And that's how we discovered that he has a shellfish allergy. But, you know, I had given him shrimp when he was little, and he did say, oh, you know, my throat's kind of itchy, my tongue itches. And I was like, oh, here's a Benadryl, you know, we probably shouldn't give you that again. But, you know, I didn't know until we had a full workup for him that if, you know, he has a potentially fatal shellfish allergy. And it's like, how did this even happen? That it's so far off the charts that, you know, if someone eats shrimp and touches a doorknob, if he touches that doorknob after done,
Wow.
it could cost him his life. So it's very scary. But the strawberries, so my point is, okay, organic is probably better for you than the non-organic, but is it, you know, it still has flaws, and you still need to wash that fruit very, very, very well and get all pesticides off of it.
Mm-hmm.
And when you can buy from a small farm or grow your own food or whatever you can do, you should do that.
That's definitely my plan for the future. Like, I do want to live, at least have a farm when I'm older, and grow everything myself. I feel like that'd be fun and also much healthier. So
Yes, well, you should live somewhere other than Michigan, because you won't be
Yeah.
able to grow things for 6 months out of the year.
yeah,
You'll
we'll
be
find
hungry.
somewhere else.
You'll be hungry the other 6 months.
Yeah.
You'll have to do a lot of canning and preserving. But it can be done, you know, just like we talked about, the dining hall. Just, I mean, it depends on how important it is for you. And I
Mhm.
think when we're talking about health and what can we do to turn this nation around and the world around, we're going to have to get into the mindset of, you know, it's a matter of life and death, because it is. You know, the human race is going to be extinct if we keep
You think
down
so?
this pathway. Yes, I think between, you know, loss of fertility. I mean,
That's
we
a big
haven't
one.
touched on that, but, you know, the sperm counts have gone down so much over
It's scary.
decades. It's very scary. And, you know, what's driving that, right? You know, probably environmental. So we just, between the fertility issues and
Culture as
just
well.
culture, I mean, we're not fostering a culture that it's cool to have a big family, that it's cool to get married earlier, or even that it's cool to stay together as a family. Like, the family unit has just lost its appeal. Like, people are like, oh, you know, divorce and whatever. But now, I think there's somewhat of a shift coming back to that, I hope. But the family unit is everything. It's so important. Everything starts there. So if we get into that mindset a bit more, then I think we'll have a chance of saving ourselves.
Do you know like the timeline of how that happened? Because I know that historically, like even not too far ago, like a couple of centuries ago, the family unit was so strong, even in Western countries like the U.S. But I think slowly, like 1900s and very recently, did it start to shift away from that. And when I read about, there's like 100 different reasons why that happened. It's partly government involved, partly like cultural movements involved. But like, where did all this happen from in the last few decades?
Yeah, I mean, I've thought about this quite a bit, and I feel like the majority of the stimulus was the feminist movement, unfortunately.
Yeah.
Us women, we got a crazy notion that we need to get jobs, and so then we have 2-3 jobs because we're raising a family, keeping a house, having a job, and so no wonder we're all half crazy, because we think we can do it all and do it well, and we can't. So you can't have it all. You just can't have it all.
Yeah, Mom, so talk a little bit about your experience, like having a job and being a mom at the same time, and like what you would have done differently, if anything. I think that's pretty important to talk about.
Yeah, so I'm one of those people that I don't like to do something unless I'm going to do it well. And so my kids know they're the most important thing in my life, by far, like way above everything else. So my job suffers, because I don't get to, I wouldn't say it suffers, I would say I don't get to put as much effort into it as I would if that was the only thing I had to do. But I have multiple things I have to juggle, so, my kids are gonna come first, and that's where I'm gonna put my energy. Luckily for me, I was able to work from home the whole time I raised them, so that was good. So I had a lot of flexibility, so I could be there for them. But most people don't have that luxury. If I would have worked in a pharmacy, because when I graduated, I thought, oh, I'm a pharmacist, I'm gonna work at Rite Aid, and I'm gonna dispense prescriptions, and then I'll be home at 5 o'clock. If I had to do that, I don't think my kids would have had as good of a quality of childhood. But what would I have done differently? And when I thought about why I wanted to do this podcast today, I do think it's really important for the young people listening to this, to really think long and hard about who you marry. Make sure you marry the right person, because it all stems from there. And someone who's very supportive of having that family unit. And I'm not saying women shouldn't work, but I'm saying it has to be such that you can keep that family unit intact, and that your kids are always top priority. So you want to make sure that between you and your spouse, that you are able to give your children a very stable, loving home. And there may be husbands that choose to stay home. I'm not saying there's a right way or a wrong way, because every situation is different, but I think that there needs to be a much greater emphasis on, make sure you choose the right person, and really think long and hard. I mean, write yourself a questionnaire of what you want to ask this person before you decide whether they're marriage material, because everything stems from that. Your children's health, your own health, everything will depend on, that decision. So, the career that you choose for yourself, be, great. You can be successful, but it's not like it all stems from, you can change careers, but you don't want to have to change a spouse. Because that's where things deteriorate, right?
Yeah.
So, what I would have done differently, I would have loved to have stayed home and taken care of my children, and been, not have to wear 12 different hats and running around. I mean, I feel like I have so much more stress and anxiety because I'm trying to be too much to too many different people. And I feel like I don't do anything really well. And for me, that's unacceptable, because I'm, a bit of a perfectionist, a bit controlling that way. And it's not a good feeling to feel like you're not doing anything well. The master of all trades.
Yeah, that's really interesting to think about, because I think that the culture has shifted to, it's not like women can work now, but it's more that they have to. You have no choice. You have to do everything. And if you don't, you're looked down upon by society. There's no other answer besides this. And I think that with the culture shift, we kind of growing up thinking that that's the only way this can be, kids will watch the Barbie movie and say, oh, I have to work, I have no choice, send me to school. And it's interesting to think about this, talking to you, because I've read a lot about this in the past and try to understand through my head what actually makes us fulfilled in life. And I think that's the big question. Everyone's trying to find that, but no one really knows what it is. But just talking to people around me, seeing what people think about in the day-to-day life here at a college level, but even talking to older people, like my aunt, for example, or talking to you, I feel like I've noticed that a lot of people realize those lessons much later in life, when what truly fulfills us. And it's interesting to look back in retrospect, how you would have done it differently.
Yeah, it is. And I agree with you. Most women feel like they do have to work, whether it's from a financial standpoint, because most people today, graduating from college, they're not gonna be able to buy a home. Inflation's out of control. The environment, the financial environment that we have right now, is really not friendly to young people. I'm very nervous about that for all the young people in the world right now. It's very different than when I graduated from college. The thought of owning a house and, having a career and all that. And I was one of those people, I would meet with other women that were stay-home moms, and I'm like, must be nice, and I just think I would want that for myself, because, I'm a career woman, and but they're the ones that had it figured out, truly, because that is a very, very important job, is raising your children. There's no more important job than that. If you want to be a doctor and you want to be a lawyer, you have things, absolutely, you can be interested in that and do those things. It comes down to what works for your family, and that's up to you and your spouse to figure out, right? But it's becoming harder and harder to afford a home, so women feel like they have to work. They feel the pressure of, if they don't work, then they're going to be judged by their female peers.
Right.
So and you feel almost like you're less than a woman if you don't have a career these days. I'm a woman, hear me roar. Again, it needs to be a cultural shift. And when did those things start falling apart? I in my mind, it was like the 70s. When I was born, these things started to fall apart. And
These ideas.
The feminist movement really did not do us any favors.
it's interesting like overhear other people's conversations too, because I think that there's also this like growing hatred toward men, and I don't think that all women think that way. I think most women don't think that way, but every now and then I'll hear this conversation with. I remember I was in the elevator the other day, and these two people were like talking about how evil men were in the history, and like because they're part of this. We have, on the third floor of our dorm, we have this like woman in STEM and research program, and they're all like, "Oh, hate men," and things. And not all of them, but I overhear these conversations. Like, I remember I was in one of my classes one day, and these people were sitting behind me. We were talking about this fairy tale, and they're like, "Oh my God, those men did that, da 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 da." And I feel like that narrative has grown too, with at least a subset of the population, which is interesting to think about where that came from.
Again, I think that came out of the feminist movement because they felt oppressed, right? They felt like, and I think women didn't feel appreciated. They felt like they weren't as respected as men were for the job that they did. And I think that that could have been addressed as well. Like men, it's a very important job for a man to do, is to validate the work that a woman does in the home and taking care of the children. If you don't do that, she's going to be resentful, and she's going to feel oppressed, and then you've got this whole cycle that goes around again. But I think that's where some of that mentality came from, is women get resentful because they have to do everything and be everyone to all of the world. You have to do too much, and so you do get resentful, and you think, I wouldn't have to work if men didn't judge me and think less of me, if they appreciated me, if I felt like I was an equal to my husband, then maybe I wouldn't feel like I have to work. I have to get a job outside the home, that I would feel like what I do in this home is enough. And then when you're home slaving all day and you go to work, and then your husband, all he has to do is go to his job, and he comes home and you've done everything else for him, then you get resentful. So then women start to feel this way about men.
That makes sense. And I think that there definitely have been men in the past who've abused power in such a way, but I think that also both roles are like special in their own way, but I think appreciating that and glorifying that.
Yes, I agree 100%.
So what would you say men need to do to show women that they're appreciated in the home, at least?
I mean, I think words go a long way. I don't necessarily need flowers, but for my husband to say, you know what, you're the rock, the foundation of this family. I'm so happy that I have you to cook these wonderful meals for me, to be here for our children, to be the great mother that you are. That goes a long way. All you gotta do is validate her, tell her how important she is, buy her a string of pearls, and tell her this is, for child number 3. I'm just so happy that we have each other, and you've given me all of these children.
I also think that it's when I think about like my future family, my future wife, like I feel like in my mind, like that is such a special role to have.
Yeah.
Like the family unit, like bringing everyone together, raising the kids, and I feel like that to me in my eyes is such a special thing. But I guess a lot of guys don't express that, or maybe even if they feel it, they don't express it, and they validate it in the way that you described that. That is a really special role, and it should be seen as that way instead of like a lower role. Like, sure, working the job's important for getting money, but it all kind of comes together toward, I think the family is where most of the fulfillment comes from in life.
Oh, 100%. Far, far, far above everything else. When you die, nobody's going to talk about, what your career was, really. Like how many days you worked. They're going to talk about what kind of father you were, what kind of husband you were, what kind of person you were, friend. Those relationships, I tell my kids this all the time, like, relationships are the most important thing in life. That will be your legacy. So everything else should be far, far, far down on the list. Have lots of kids and have them early. And work out a relationship, a situation with your spouse that allows your kids the best life that you can imagine for them.
I think we were reading something before this, me and Teo, that if you put someone in isolation, it like cuts their lifespan almost like in half. It's crazy.
Yeah. And it's one of the reasons I hate social media, right? Because we're social creatures. We need to interact with each other. We need relationships, intimate relationships. And I think having big families, I can't imagine anything more wonderful and beautiful than having, a table of 20 people long and having all your kids sitting there. All those little, and they're all so different, right?
On their own world.
They are. Each child is so different than the other. They're all gifts. Children are gifts to the universe, and just have as many as you can. and cherish them, and cherish your wife. If she feels cherished, I think that everything will be fine.
That's great advice.
And she should cherish you. She should cherish
Goes
you.
both ways, yeah.
Yeah, it goes both ways. I mean, you're out there working hard to give her a nice, beautiful home, a stable home, things that she needs, but also some of the things she wants. And that's hard too, to feel that pressure. I think, not enough people, especially women, understand the pressure that men are under. Even just from dating these days. I don't know how you do it. I don't know. It was so different when I was growing
What was it like
up.
back then?
Well, I mean, the guy always asked the girl out, and you didn't send her a text message, and I don't know, like there was nothing to do but hang out with each other, so you met people all over the place all the time.
In person, yeah.
Yeah, so, we went to proms and we went to dances, and, those were just like places to meet new people and, figure out who you like and who you want to talk to. And I mean, like this, talking to each other is so valuable. So finding your spouse comes out of having deep conversations, or should, right? It shouldn't be like, oh, you're cute, I think I want to marry you. It should be, we have a lot in common, and we share similar values, and you're cute.
I think the biggest problem that happened with feminism was this idea that individualism equals fulfillment. That's, I think, is a mindset most people are in, that like, I don't really need family. Like, why the divorce rate's like 50%. Like, why do we need each other? I can work and I can clean. I can do everything myself. Like,
right,
for both guys and girls.
Yeah.
That we don't really need each other anymore. And that's, I think with social media, sorry.
That couldn't be further from the truth. Like, okay, you may not need a man. Like, okay, could you live without one? Yeah, you can't propagate the human species. I mean, you can eat each other. And there's nothing more beautiful than that relationship between a man and a woman.
I think the thing we talk about with social media, like, I think it changes the way you look at the world.
Yes.
I think when you have like 1,000, 2,000 followers on Instagram, like, you really realize, like, you kind of put yourself in more of a pedestal with all the options you have. And I feel like it's definitely changed interactions in the real world a lot.
Yes.
And I try to like maximize as many in-person interactions I can. Like, I try to do everything in terms of meeting friends and meeting girls like in person. I try to do that as much as possible. Like, sometimes I'll be friends with someone and I'll have their social media for like 5 months because I just see them everywhere. And I think that encouraging more of that, because obviously going online is easier. Such a cop-out for doing something difficult. But
I mean, online dating or whatever, these apps, I mean, what a nightmare. Just a nightmare. I can't imagine. But how else are you going to meet people these days? You're on your phone all the time. I'm not saying you specifically, but I mean, kids are on their phones all the time. Yes, it is so important to have those in-person interactions.
I think what helps me a little bit is that I think everyone secretly wants it, but they're too scared to. Like, I think everyone secretly wants in-person reactions. If you're the person who goes out and does it, like, they'll be receptive to it, whether that's male friends or looking for females. I think that everyone secretly wants that, whether that's more of an adventure in their life or more of like an escape from it, but it's just so hard to do it on your own. But I think if you're the person who goes out and does it, you can find people and bring them into that.
Yeah, you definitely have to want it these days. It's not going to come to you. You have to work for those personal interactions. It is a tough time. I do not envy, especially the men trying to date these days. And I mean, just the thought of rejection, from a girl, I can imagine it's terrifying. Just terrifying, to think, okay, I may approach this person and they may say they don't like me, but I would say, don't let that stop you, because it's not meant to be, right? If that person.
Charlie and I have been hard at work the last couple of months.
Good, as you should be. Have parties, invite people over, get to know people, play spike ball, lots of spike ball. Get out, enjoy the sunshine, get some sun, get a little bit of a tan. And that's the other thing I wanted to bring up is, or I was just thinking, if you don't enjoy the bar scene, that makes it very difficult too, especially if you don't drink. I mean, I've been harassed my whole life about the fact that I don't drink now at all, and I never really drank very much at all to begin with. Never smoked pot, never did any drug whatsoever. I mean, that was way more, well, I don't know if it was more of a thing then, but there was a lot of recreational drug use in my circle growing up, and I never did anything. And people would harass me. So it's hard to be that one person that is, you have to take a stand, because people can be cruel, and they make you feel like you're less than, or, something's wrong with you. And, if you don't have the right network and, family and, people surrounding you, telling you that you're doing things right, that can be tough.
I think so, yeah. I think definitely the culture of bars and going out is huge at a big school like this, but I also think that's so big that you can always, navigate a lifestyle without it and still meet, so many incredible people. The school is just big enough that you can get away with that.
Yeah, that's
And,
good.
whether that's just meeting people outside, just living a day-to-day life and just meeting people along the way and just overcoming the fear of doing that and realizing that there's actually, so many cool people all around you that are just kind of hiding and you don't really know they're there.
Yeah, you got to go out and find it. I mean, I was not a sorority person. I wasn't a bar person, but I still had lots of friends and went out and did things and had lots of fun. And so it can be done, especially in university. I mean, these are going to be the best years of your life. You just don't know it yet. You're going to look back when you have a mortgage and car payment. You're going to be like, oh my God, I long for the days when I could just do what I want to do, wake up and decide that, you want to do, and whatever it is you want to do, and it's all for you. And you don't have to consider pretty much anything else.
Mm-hmm.
There won't be that, it won't be that way forever, I guess. So
Yeah.
just enjoy it.
It's the perfect balance between you're an adult, you can do what you want, but you just still have so much freedom. If it's warm outside, I'll just tell them to come outside and play spikeball for the rest of the day, and then go to muscle ups to the pull up bars and just do whatever we feel like doing in the moment.
Yes, it's the perfect time to be an adult, right? It's the perfect adult is to be one without really any obligations. Yeah, you got to go to school and you got to, that part of it. But other than that, the world is your oyster. You get to do whatever you want, hang out with who you want for as long as you want. If you want to work out, or I don't know, there's just whatever you want to do, and that is rare as you get older.
I want to bring up with another thing that I struggle with that I think a lot of people like me struggle with, including Charlie and a lot of other people. And I bring this up with you because I know you're also very passionate about health in a way that you want to make sure you're healthy, take care of your body. That means avoiding cosmetic products that have a certain ingredient in them. You showed me the app Yuka that I've been using now. Or just avoiding dining off food or paying attention to everything you eat and being extremely disciplined about it in meal prepping. And I think that we struggle with balancing the discipline with the fun. And I think that's okay, it's nice outside, I want to play spikeball all day, but I'm constantly worried about my meal schedule and I have to do this thing and that thing. And I wonder what your thoughts on that, and just in general with young guys that tend to get locked into this mode of just I need to get my things done, I need to be on this strict schedule, I need to be sleeping at this time, I need to be eating this thing, versus my friends are all going out to eat dinner and I can't because of it's this unhealthy, etc. Balancing that's been a struggle. I think I've gotten a lot better at it this year, but I wonder you probably noticed that in maybe your children or even just young guys in general. So I was curious.
Oh yeah, even in my own life, right? I go out with. One of the places I struggle the most is in the work environment, because everybody likes to eat dinner at 9 o'clock at night, and I'm usually in bed by then, or at least getting ready for bed. But I get made fun of because I don't drink, I won't eat late, I like to go to bed earlier. What are you, grandma? So it's tough. I mean, and you can't be so rigid that you lose out on important opportunities to interact with other people. So it's just kind of you have to figure out, all right, if you're going to go out, how late are you going to stay out? It doesn't mean you have to stay out till 1 a.m. You can stay out till 11. And you have to tell yourself it's okay that I'm leaving the party before everybody else. It's okay that I'm not drinking alcohol. It's okay that, they're all eating cheeseburgers and I'm going to order the salad. It's deciding different levels. Does it mean you can never stray from your schedule and you always have to eat organic and you always have to eat food that you cook for? No, because that is a very hard way to live. You have to give yourself some freedom to have fun, to let your hair down, and because otherwise there's too much stress and anxiety that will completely counteract all the other things you're trying to do with eating healthy food and being on a regimen. You see what I mean? So as I tell my children, it's all about balance. And I don't believe in, everything in moderation. That is not my mantra. I hate that, actually, because, being a pharmacist, you can't eat cyanide in moderation. That's not going to work out well. So but balance is important. Balancing your social life and the importance of how that feeds your soul and your mental health with your physical health, your diet, all of that, and your sleep schedule. And, you'll have choices to make every day. And if you've partied and stayed out till midnight the last 3 nights, maybe you don't do that the next 2 nights. You're going to have to say no to some things. But it's all about balance. It's all about trying to prepare ahead as much as you can. Try to think ahead more of, okay, I'm going to dinner with these people, and I know this is going to be on the menu. Like, I'll look at the menu before I even get to the restaurant and be like, okay, I don't know what I'm going to order here, but at least I'll have some idea before I get there, because otherwise I'll be like, I'm starving and I'm going to order the cheeseburger. So I don't know. It's just doing those types of exercises to help yourself out when you can. And, I don't think there's a magic answer to that.
Yeah, I guess we learn with time, just adjusting.
You will, and be forgiving of yourself. You're going to make, I wouldn't say it's even a mistake. It's, sometimes you let yourself live a little, right? Yeah. And you have to do that. Mm-hmm.
Agreed. I've never drank alcohol either, and never done anything, honestly. And Charlie's the same way. And I know
it's rare.
Yeah.
Yeah, it's very rare.
I'm just curious. Look, I have my own opinions about it. I'm for the most part against it for both the long-term effects of it, which we all know are bad, but even like the short-term effects of it. Like, what's the point? Like, just stimulating yourself, like having these like mediocre interactions with people instead of like building more deeper interactions in day-to-day life, which are 100% possible. But again, there's also like those long-term health effects of it, which is why we stay away from it. But I'm just curious about, because it's a huge culture. Like, it's like 90% of people do it. Maybe less than 90, but a lot of people do it. It's pretty normal.
Probably 90%, yeah, there's a lot. Mm-hmm.
I'm curious about like your thoughts on it overall, both from like long-term health impacts of whether that's smoking or alcohol or any substance, and even just the short-term impacts of it, like people who try to integrate it to every part of their day-to-day life just to kind of be normal.
Yeah. Well, alcohol, I think, the last few years, data have come out, and actually the World Health Organization says there is 0 amount of alcohol that is healthy. It is a toxin. It is a carcinogen. It causes cancer, period. End of story. My father died from it. My grandfather died of it. Too much alcohol. My father died of pharyngeal cancer. Too much alcohol. My grandfather died of stomach cancer. That the long-term effects can be severe. And, I don't even really think so much about the ethical, the moral aspect of it. I think of the health effects of it. It is a toxic substance, and I don't see the point. I really don't, of ingesting it. I don't know, you dull your senses, you numb your pain. Okay, well, I don't see how that's healthy. I really don't. Because at some point you have to deal with all those things. And it does, it impairs you, and it can cause danger. And then in women, it's very well known, if you're trying to get pregnant or if you're pregnant, you cannot have any alcohol, 0. So sometimes you have an oopsie, like you don't know, and you would hate to be in a situation where you had a bender the night before and you find out you're pregnant. So I just think it's just not worth it for me. Other substances, cigarettes, absolute no go. What are we doing? No, absolutely not. I don't know. Like I can't even understand.
I don't get it either. There's so much fulfillment you can find in the real world. I think that people don't realize that there's so much out there you can do in this world. It's
so smelly. It's a disgusting habit. It's toxic. There's just no redeeming qualities whatsoever from that. And I know a lot of people really believe in, marijuana, and they think, oh, it's so therapeutic and it's, it's benign. No, I'm sorry. There's clear data, and it's just like alcohol. People ignored for the longest time, like, oh, it's heart healthy. Glasses of wine are very good for your heart. Well, that is BS. That's not true. It is not healthy for your heart. You can tell yourself that if it makes you feel better about drinking it, but it doesn't make it true. Same thing with marijuana. Any of that, mushrooms, hallucinogens. There's nothing healthy about that. Like, you need to be natural. Like you're not going to go eat a bunch of mushrooms in the forest. Like, hopefully you don't. I just don't think that it serves a purpose, and I think there's just way too much downside and very little upside, even if there was an upside to marijuana. And again, that wasn't why it was legalized in many states. It's because people don't think it's dangerous. It's all about making money. And again, when that's your priority, it's probably not a good thing. And there's always a red flag when money's driving something. And when you're looking for something bad, all you have to do is follow the money. So I think that's, the pot industry is all about the money. And
That's most industries.
yeah, I mean, we're not doing ourselves any favor. I mean, we're all going to be walking around with schizophrenia from all of the structural changes that are happening in your brain from these things. So I think keep yourself clean.
Amazing. Well, I'm 18 and I plan to build a family early 20s hopefully. And after seeing how well you've been able to raise your two sons, I'm looking for some advice from a parent about how to be a good parent.
Yeah. Well, again, I think I shared with you that's what I'm most proud of is my two kids. And I don't think it's an accident they turned out to be good children. It's hard work. You have to put in the work as a parent. You have to say no in times that you don't want to say no. You know what's best for them, and you have to do what's best for them. Sometimes when it's not convenient, when it's, shutting down their fun and telling them they can't have birthday cake at a kid's birthday party. But I think the key to being a good parent is being present in their lives. As I mentioned in my quote, you have to listen to everything they say. I mean, I treasure the moments I would pick them up from school or take them to school. I was like, that's where I get all the great information on, which girls they think are cute, or, how the math test went, or whatever. Those are the moments that matter. And they're all little, and they all culminate into a relationship that you have with your child. And you'll have a good relationship if you put in the time. If you don't, you won't. And doesn't everybody want that? When they're an adult, don't you want to have a great relationship with your kids? So it all starts from when they're very little, and making sure you are there. And as a father, it looks different than as a mother. If you're in a traditional family unit, it looks different. But when you're there, make those moments count. You may not be there as often, but make them count.
So you feel like the biggest lesson is actually giving them attention, just actually listening to them, being there with them, like that you said in that one quote of yours, where you're just listen to every single thing they're saying.
Mm-hmm. Yeah, and do things they want to do. Don't drag them along for all the things that you want to do. I mean, sometimes it's okay for you to have them do something that's fun for you, but they're only little for a while, and 80% of the one-on-one time you have with your children happens before they're 12 years old. That's not a lot of time.
Mm-hmm.
So can't you put your things on hold for a bit and do what your kid finds fun? If they want to go jump at the icky trampoline place, okay, well, you're just going to have to do that.
Mm-hmm.
Because that's what they want to do. And, and there are some things you don't want to do. Like, I don't particularly enjoy swimming. My kids are always like, Mom, get in the water. I'm like, oh, I hate the ocean. I don't like what's lurking beneath. So some things I won't do, but I'll go to the beach with them. We'll walk the beach. We'll look for seashells. They're, certain.
No shellfish, though.
But, yeah, I mean, spend time with them. Make the time count. And just know that they're only little for a little while. And then they're going to be off to college, and you're not going to believe how fast the time goes. And whether or not that child has anything to do with you once they go off to college really depends on how much quality time you spent with them before they went.
You mentioned before that at times you have to be strict and tell them okay, you can't eat the birthday cake. I've had plenty of conversations with people debating how strict should you really be with your kids, because that's always one that I've struggled to understand. I feel like a degree of strictness is important, but how much? Because I've seen so many examples. I remember there were these two guys that went to my high school, and they had really strict parents. They had to sleep at 10. They couldn't do anything fun. And I ran into one of them the other day when I was actually coming back from Charlie's place, when we filmed at the hot tub. I ran into him, and he was just so different. It's he came to Michigan too, so he changed so much. And he was just he goes out, he drinks all the time, he stays up, and he's finally has a freedom that his parents never allowed him to have. So I see that happen a lot. I think that there's things you can do as a parent to prevent that, because by embodying the spirit of what you want in them, balancing strictness, but also making them understand why we do what we do.
That's right.
So I'm just curious about your perspective on how strict should you really be with your kids?
Yeah, and that's something I still look back on, and I'm like, should I have been more strict? And I think even Charlie will tell you, he wished I would have been more strict. And if I look back and I'm honest with myself, I wish I had been more strict. I was pretty strict. I'm a pretty strict parent. I mean, I'm the mom that threw away his Nintendo DS because I told him to stop playing and he needed to do it. I threw it in the garbage. It never should look back. So.
Yeah, I mean, we talk about that all the time. Like, I do wish you were more strict on me. Like, you were very strict, and I'm super appreciative of that, and I tell you that all the time. But, like, I just imagine where I'd be now if I had never played a video game in my life. I had never eaten junk in my life. I was forced to socialize more, those sort of things. I can't even imagine where I'd be now, you know?
Yeah. Because in his mind, he thinks he would be better off.
Mm-hmm.
And I would tell you that that's such helpful information to know. So we all need to be able to learn from the mistakes of others. It's hard first to admit that you made a mistake, but it's so important to do that. And then for me to tell you, okay, you don't want to be so strict that they're completely paralyzed and and demoralized. But if you think you're being too strict, you're probably not strict enough.
Interesting.
And decide for yourself before you have children what your values are, what your standards are, and don't alter those, because you're going to let people influence that. They're going to be like, oh, it's okay for them to have the goldfish crackers. I mean, I didn't let my kids have goldfish crackers, they never ate a school lunch, ever.
The school lunch suck. I used to eat such unhealthy school lunches.
Oh, I would never let them eat that, and I was like, absolutely not. You're not eating that crap. So I made them a lunch every day. That's a lot of work. It's a lot of work to make them lunches, but it's worth it. Do you send them to a birthday party and tell them they can't have any cake and all the other kids are having cake? That's a tough one. My best friend is that mom. She's that mom that tells her kids you can't have birthday cake. They can all eat it and you're gonna have carrots. But but her kids are fine to this day. But I think you will know. That's why each kid is different. You have to know your child. And if you can envision them going off the deep end when they get to college, you need to have some serious conversations with them and always share with them the why. Okay, I don't want you drinking, and here's why. I have a 16-year-old right now. He just started driving. All of his friends drive around, past 10 o'clock. They have like 6 kids in the car at once. And I'm like, no, it's a law for a reason. And do you know why that's a law? It's a law because it's distracting for you to have all those kids in your car. And 10 o'clock at night, there are drunk drivers out, people coming home from the bar. Like, it's just a more dangerous time for you. It's dark, and so that's why we have laws, and I want you to obey the law. That should not be negotiable. My other friends are like, oh, I'm going to let little Jimmy drive all his friends around. And it's hard to be that mom that's like, well, you can do that, but I'm not going to. And my son will tell me that, well, my other friends do this. And I always tell him, well, I am not your other friend's parent. I'm your parent.
Yeah.
And I've decided that I'm not going to let you break the law. And you can be mad at me if you want to. But if you ever got hit by a drunk driver, or you were in a bad accident because you had 5 kids in the car and you were distracted, I would hate myself.
Yeah. I definitely agree for the most part that strictness to a degree is important. Like, I would never let my kids drink or let them like do stupid things like that. I'm just curious about like some of the examples you brought up. Like, I wonder, I guess it changes kid to kid. Like, for example, if there's a kid who's the only one kid who's not having the birthday cake, like, sure, there's health impacts of eating a birthday cake, but I'm curious about what like the psychological impacts are of like being like the outcast, right? And that's something I've thought about a lot too. And I feel like for me growing up, like, my parents were strict, but not like super strict. Like, obviously they would imply that don't play video games, but I'd still play video games if I wanted to,
Yeah.
And I feel like I've made so many mistakes growing up that I've learned so much from it that it's now like I'll never go back. And I used to play video games till like 3 or 4 in the morning during COVID and not think twice about it. And it honestly ruined like a year of my life, my freshman year of high school. And the pain that I felt not being able to socialize with anyone drove me to actually fix it, which I feel like, again, not everyone ends up in such a perfect like poetry like situation where they actually fix it. So some degree of parenting is needed. But I wonder, because like some of the things my parents embody fully, like my dad never drinks soda, my mom doesn't drink soda at all, right? And they imply it. They're not strict on me. Like, maybe I've had it once at a party. They didn't say anything, right? But they imply that, oh yeah, it's not good for you, and they don't do it. And for me, it's like I only had soda like twice in my life, and it just makes sense to me. Like, why would I have soda? They don't do it. So I've been like really curious about this balance of like, okay, like 100% you have to embody it. Like, we all agree upon that, but how strict should we be about it. I'm kind of glad my parents weren't super strict on me because I learned those lessons, a lot of them. But again, like every child's different. It doesn't always work out perfectly for everyone, and
Yeah,
you know.
and some kids learn those lessons on their own. You don't have to set those guardrails, as stringent. So yeah, it depends on. I think you have to parent each kid differently. You can't just like have a cookie cutter set of rules that for the most part. I mean, you want it to be consistent, but your kids will have different interests. They will have different friend groups. They'll have different influences, and you have to deal with those in real time. Some things you can't predict.
For sure.
And if you see your child suffering because they are playing too many video games,
You should step in.
yeah, you have to. It is your duty to step in. They're going to be mad at you. They're going to be super mad at you. And even like when I threw away Charlie's Nintendo DS, it wasn't even so much. It was the video games. He was playing too much video games, and I knew it was bad for his brain. And I was like, I will only allow it. And I was very strict. It was, during this time for this amount of time a day. And I'm like, that's it. And when I tell you you're done, you are done. And he just pushed it and pushed it and pushed it. And for me, it was more about when I tell you to do something, you do it. I'm your mother, and you have to respect what I don't care if you think you should play more video games. That's my decision. And I said no. So it went
Very
bye-bye.
interesting.
But I wonder if your friends' parents drank a lot.
My friend's parents.
The one that you said that you saw on campus.
I mean, I wouldn't be surprised.
Mm-hmm. Because I think kids are not stupid, right? If you live your life in a way that you're telling them not to live it, and you're being super strict on them, but then you witness your parents making a series of bad decisions and living their life in a way that's not admirable or respectable, I should say. It's such hypocrisy, and it's mixed messages, and so I think that may have a lot to do with that. I mean, it is your duty to be a role model, and again, it's so much pressure as a parent knowing that your kid is watching and listening to everything. Everything you say, everything you do, they put it in the bank. And it influences how they are as they become older. So they see you going out on a bender, but you're telling them you can have 0 alcohol, and that's my rule. Or you have to be home at 10 o'clock, but
That makes sense.
So I think the role modeling, just being consistent about it, telling them the why, and is it the end of the world if they have a piece of birthday cake? I mean, don't get me started on why we have to celebrate everything with food, because that's just, it makes me so upset that, we celebrate everything with food.
Yeah.
If we're sad,
Eat.
it's time to eat. If we're happy, let's eat. Whatever, it's Tinkerbell's birthday, let's eat. It's always a reason to eat. So I think we need to shift that mindset as well. So birthday cake, I mean, can we do something other than eat at a birthday party? I'm just saying.
Yeah, play some spikeball.
Let's just do something fun and forget about the food aspect of it. And they always expect pizza.
Oh,
going to
yeah.
a birthday party,
It's horrible.
they have to have pizza and a cookie cake.
Fanta.
Yes, and we don't drink soda either. But
Yeah,
my kids
that's
don't
good.
drink soda because I didn't drink soda.
Yeah.
I want to talk about the things that like I did rebel on a little bit more.
Yeah.
Like you allowed me to play video games a little bit, and you allowed me to eat a little bit of junk food, but you always said no drugs, no alcohol.
Yes.
And I never rebelled on the no drugs, no alcohol ever.
Yeah.
I never even had that thought because it was so prohibited, and you were like, this is horrible for you, and you were totally right. I think the same thing with video games and junk food now.
Mm-hmm.
Like I look at, as soon as I got to college, I did eat a little bit worse because I was, bulking, right? And I played more video games because I had more free time. But like, I wonder if, had you instilled like the idea that, you should not play any video games or you shouldn't eat any junk food, I wonder if I would have not rebelled on those things as much.
That's interesting.
Yeah.
I feel like the more I'm hearing you talk, though, I'm realizing that I think the biggest factor that we all agree on is like being the role model. Because my parents never drank, both of them, ever in their life, and I maybe once, but almost never like even considered drinking. Like it's very easy to me. Like there's almost so much resistance, even if I wanted to do it. Like I couldn't get myself to do it.
Yeah.
And I feel like you're an example of a strict parent. My parents were not as strict. But then even if I look at my friend group and all my friends who I would deem as like really successful, like some of them had strict parents, some of them didn't. But I think that the key factor that changes the outcome is honestly just embodying the spirit that you want your kids to.
Yeah.
Because I feel like that's the one common theme I see in all my friends' parents who I respect. I think that's honestly the most important, and that gives me some mental peace as well, because that just means if I do a good job on my end of like living how I want my kids to live, then they'll probably follow through as well.
Yeah, I can't imagine that you're active, you're healthy, you're eating healthy. Like, you're not gonna have junk in your house, so they're not even gonna want that, because it's very, hyper palatable food anyway. You want them to learn that healthy food tastes good. They're not going to learn that if they have a household full of junk.
Oh yeah.
So again, yes, embodying, the spirit, the values that you want your children to have. If you're living that way, they're going to end up that way most likely. And then you'll have things that are your non-negotiables, like drugs, alcohol are non-negotiable. I mean, my kids know, like, I would hunt them down, and there would be no mercy if something were to happen like that. There's just, I can't even think about it. It just makes me upset to think about, and they know that. So those, again, that's my non-negotiable. They know it's a very, very, line drawn in the sand kind of issue. But then there are some things, video games. I'm like, okay, I know they're terrible for my children, and junk food is very terrible. But am I going to say, can you never play a video game in your whole life? No, I'm not going to. But I'm going to limit it, and you're going to respect my limits, or you're going to have none. So that was my thought, is I will let you play some, but you have to respect my rules.
Yes.
And you can have some junk food, but are you going to eat it every day? No, you're not. Am I going to buy potato chips and cookies and keep them in the cabinet, and you're going to eat that over your dinner? No. So you just have to figure out, non-negotiables, and then even the things that are negotiable, where is your stopping point?
Yeah.
Mm-hmm.
It's amazing. What are your thoughts on bulking?
Bulking?
Yeah, as we all do.
I mean, I think it's fine, really. I think it's fine. I don't, depends on how you bulk. You're eating a bunch of candy and other stuff.
A lot of people do that.
Yeah, I mean, I would say if you're gonna bulk, at least eat healthy food. You
Yeah.
just got to eat a whole lot of it. My stepson is, trying to bulk right now. I mean, he's 6'7" and
Damn.
very skinny, very, very skinny. And the kid just can't gain weight.
Yeah.
And
Tough
so
one.
we're making him, 2,000 calorie protein shakes, trying to put weight on him. But it's all with healthy food. I put oats in his smoothie, and coconut milk and shredded coconut and everything I can do to get calories in there, but that are not from sugar or junk.
Yeah, I mean, I think clean bulking is 100% possible. I mean, I've done it, and I only bring that up because I guess I've learned more recently that it's not like a natural state to be in. Eating that much, it's probably not good for you, but for periods of time, especially when you're young, I think it's fine too. Like,
Right.
at least early 20s, like doing a little bit to get to a place you're happy, and then like kind of stay
Yeah.
there for the rest of your life. But
I
yeah.
agree. I mean, I think it's, of all the things you could be doing in college, if that's the worst you're doing, I'm okay with that.
Cool.
If you're not, as long as you're not taking, testosterone or something crazy to bulk up. Because again, that was another non-negotiable. That's a absolute line in the sand. No, not happening. So we go round and round on that one, just because it's like, what if I'm older and I'm deplete and, maybe I need some. I'm like, well, we'll talk about that, when you're older and when that time comes. But I think if you're living your life right, truly, and taking care of yourself, that's not going to be an issue anyway. Take care of yourself, keep your testosterone levels up
Yeah.
naturally, normally. You're not going to have those issues. The reason why people, lose that is because I bet you most of the time they're not living a healthy lifestyle.
Mm-hmm. And like, assuming the keys of that are just like eating clean, lifestyle, like staying active, sunlight. Anything else that you think are big for sleep?
Sleep is huge. Yeah.
That one doesn't get talked about
That's when your
enough.
hormones are released and you're in deep sleep. So you got to make sure you're getting deep sleep. And if you
Yes.
don't monitor your sleep, you should. I mean, but you can get yourself in, kind of this vicious cycle. You can kind of psych yourself out of it. Just obsessing over your sleep.
I've done that before.
Yeah. But it's very important to know what kind of sleep you're getting, how much sleep you're getting. I mean, I get like 8 hours of sleep a night, but I get very little deep sleep. Can't tell you why. I don't know why, but I can't get deep sleep. So it's no wonder I wake up a lot of times not feeling refreshed.
Interesting. I usually feel good. Like, I've been getting 9 hours pretty much every day, and I usually feel good off of it. In high school, I was like, I cared about the time I slept and the time I woke up, like, intensely. Like, I would never miss a day past my bedtime, which I think was good for a period of time. But I think coming into college, like, this semester, I've been, like, every day I sleep at a different time, which I think that's definitely impacted my sleep a lot, which I think this summer I'm going to go back on a sleep routine. I think periods of time I might slip up and, like, start sleeping later on some days as well, but...
Yeah. I think consistency is very important. Trying to have a consistent, time you go to bed, time you get up. But again, should you be so rigid that you might have to study for a test, like you're just running out of time and, you could use those 2 extra hours that you normally probably would have gone to bed to study. Most of the time that doesn't work in your favor. Sometimes it might. And so sometimes it's justifiable to not go to bed at the same time. Again, you can't get yourself so regimented that it gets in the way of living a happy, productive life, right? But for the most part, try to go to bed same time, wake up the same time. It makes a difference.
I definitely remember that's the time I felt most refreshed, when I would just sleep at the same time every day, wake up at the same time. Like, I would jump out of bed before my alarm. Like, I'm just used to getting up at this time.
Yeah.
I do miss that, but...
Well, and I mean, you probably did yourself huge favors, like just growth-wise, mental health-wise, everything in high school. Those are very formative, critical years for growth and development. You need your sleep, and you need to let your body do what it does. And sometimes you need more sleep than not. There's a reason why teenagers sleep forever sometimes. They need it. They're growing.
Well, thank you so much for coming down today. Learned a lot from this conversation, and it gives me a lot of hope for the future to see more people like you out there sharing important information, spreading your beliefs and thoughts with the world so that they can do their own research, learn for themselves instead of blindly following a narrative. And maybe a couple years from now we can run this back and see what's changed, I guess, with this administration, and see progress has been made. And it's an honor to feature you today.
It's an honor to be here. Thanks for having me.